Also tonight, it has been a long time coming, but the state health department says medical marijuana should soon be in the hands of those who need it most. This process started in July of 2014 when the governor enacted the Compassionate Care Act. In November of 2015, the governor signed the Medical Marijuana Access Bill. Now, according to the state, medical marijuana will become available at dispensing facilities across New York later this month. But one father fears too many lines are getting crossed, potentially delaying this process even more. So are his fears well-founded? 7 Eyewitness News reporter Jill Perkins picks up that story from there. Jill.
Patients deserve the best. I'm kind of stuck between being a parent and a professional.
We first introduced you to Daniel Rishka last week. He's a pharmacist and a father of 2 children who he says would benefit from medical marijuana. But just days before New York State is set to start dispensing the drug.
The problem is going to your doctor and asking them if they actually have been certified, which I'm finding a lot of the doctors haven't been registered yet.
In Daniel's case, his children's doctors have not. But even if your doctor is registered, there's concern dispensaries won't open on time, that they won't have enough product, and that patients won't know the product they're getting.
Each company can put out 5 different strains. So is it going to be up to the doctor that determines the strain, or is it going to be up to the dispensing facility that says this is appropriate? So who takes the responsibility?
So how will doctors know the product they're prescribing?
It's up to the physician's knowledge, time, and his or her willingness to research a subject.
Dr. Laszlo Metzler, the medical director for Dent Neurologic Institute, is working on guidelines and protocols for physicians to follow as medical marijuana becomes legally available to patients in New York. But Dr. Metzler says some physicians are hesitant to get involved.
We are dealing with a treatment that presently does not have a scientific foundation. So when a physician prescribes a medication that has not been shown in the literature, in science, to be efficacious, they take a significant risk with the patient and their own license.
Dr. Metzler says more research needs to be done, and it needs to be done federally. But because medical marijuana is classified currently as a Schedule I drug, there's not a lot of practical research available. All of these issues snowballing into confusion, frustration, and ultimately inconvenience for the people who matter most, patients like Daniel's children.
This whole process needs to have a governing body. Instead of going to the Department of Health, have someone look at something from an objective standpoint to see if there's something better that can be done that helps the patients, because this is medical. This isn't recreational. These are sick patients. They need help. We've been battling with diseases for years, and some just don't have the time.
Now, Dr. Metzler says the Department of Health has a list of physicians registered to prescribe medical marijuana, but that it has not been made public. We've reached out to the DOH to present these concerns and get some answers, but have not heard back as of now. Now, there are 20 dispensaries statewide. There will be 2 locations here in Western New York, and patients all over the state must pay out of pocket. Much more information is available on our website, WKBW.com. Jill Perkins, 7 Eyewitness News.